panel. So can pregnant and breastfeeding women have the vaccine? So that's can pregnant women and breastfeeding women have the vaccine? So I'll ask Dr. Naseem if you can answer that, please.
Yeah, common question. Unfortunately, we don't have the data yet to say that it's totally and utterly safe in pregnant women, so it's not routinely offered. But you have to remember there are the group of pregnant women who are vulnerable. So women who have got underlying health problems, maybe kidney problems, lung problems, even heart problems, who would definitely benefit from the vaccine and who should get into a discussion about having the vaccine with their GP, with their consultant, because the benefit of having the vaccine for them, both from a immunological point of view and a clinical point of view, would outweigh the risks, and there are very minute risks, I think Dr. Bernard would second that, of having the vaccine. So we need more data. The clinical trials are still ongoing, and that's a good thing, because if you look at the whole scenario now, the government's not just saying everybody can have it and everybody should have it. It's a safety approach. It's an approach based on clinical trials, based on science, and based on best practice. So the data is going to come out soon. We're expecting that is going to be recommended for all pregnant women, because there's no reason from an immunological point of view that pregnant women should not be vaccinated, but we still don't have the data. And go on, Bernard.
No, I was saying, please continue. I'll just come in when you're done.
Okay, and I think with breastfeeding women, there's no problem. I think breastfeeding women should be vaccinated, and if those antibodies, soldiers and shields go through into the fetus, into the baby, into the newborn, that's a good thing. That's going to protect the newborn from having the virus, from having coronavirus, and potentially having serious disease. So vulnerable pregnant women, vaccinated, should have a discussion, and they should have a low threshold to get vaccinated, and routine vaccination for pregnant women. Watch this space.
Dr. Bernard, did you want to add to that, or?
Add that we never ever routinely give anything that's just been approved, any new medication or new vaccines, to pregnant women or children. We don't do it, and so this is no different. Doesn't mean that it's not safe. It just means that every single safety protocol and normal safety procedure that we follow has also been followed in these vaccines. That's all. We are offering it to women who are at high risk of catching COVID or at high risk of getting really ill with COVID, because it's a risk-benefit ratio. We know how bad the virus can be for those women, but we don't think there will be any problems with the vaccine. So that's why that risk-benefit ratio. In fact, many pregnant women who work in the NHS have had the vaccine without any issues, and many breastfeeding women have had the vaccine without any issues. And as Dr. Naseem said, the soldiers that the immune system builds to protect us from the virus has been found in breast milk. So those babies are getting the benefit of the vaccine, the protection from the vaccine, just because their mums have had the vaccine themselves.
Okay.